Let's take you to this now. Lack of leadership and implementation should be high on the agenda of the much-awaited inaugural sitting of the National Dialogue scheduled for mid-December. This is according to political analyst Professor Tinyiko Maluleke, who said at the heart of the country's failure over the past 30 years is its weak leadership, failure to implement government policies, and all of the recommendations from the number of summits, indabas and commissions it has held. Now, the dialogue raises pressing questions about the nation's journey and its direction going forward. For more on this, let's now welcome Dr. Lesley Ann van Selm from Khulisa Social Solutions. Dr. van Selm, thank you so much for your time and good afternoon to you. So, in the wake, of the Zondo Commission, under the backdrop of ongoing corruption, crime, high unemployment levels, and as the country is still marking 30 years of democracy, what for you are the cornerstones of a successful and impactful national dialogue?
The only way it's going to work is if we really embark on dialogue. The South African landscape has been plagued over the past decades by government departments, corporates, NGOs, civil society working in silos. Despite so many policies being in place about intersectoral collaboration, about partnerships around looking at the needs of the grassroots people and geographic ecosystems and not just a sort of splash of national needs, we haven't seen many or any of the policies really being effectively implemented, which is very sad, and that's resulted in a downward spiral of the inequality in our country. Unless we start looking at how we invest in the systemic needs, the actual causal factors of GBV and substance abuse, which are mere symptoms, unless we start looking at the dysfunctionality of our different communities and start addressing those fundamentally, we're never going to see any change in this country.
Post-elections, we have a seventh administration under the Government of National Unity that seemingly has a lot of South Africans hopeful. When you look at what is happening just in the field of social impact and community development, what do you think is important for our leaders to do to meet the needs of the community in the pursuit, of course, of social betterment, through sustainable approaches? We've just seen a clip now of an Eastern Cape mother completely devastated by poverty. And those scenes cut across many provinces. And those are the people on the ground in our communities who really just want to see change.
So we played by hopelessness, and we've done so much research pre-election around the attitude of the youth around voting, and 82% of them said we couldn't be bothered because nothing's going to change anyway. So the real need in our country is to educate our grassroots community members on how to be active citizens, how to understand rights and responsibilities, how to understand how the local councils, IDPs work, and to empower them to be able to go and negotiate with local government to address these problems at the time when they're happening, instead of waiting to toy or waiting for a disaster to happen and then only to be bemoaning their fate. This shouldn't be happening. There should be collective responsibility. There should be a meeting point where the community really feels that they have agency over their future, where there's transparency, where there's where there's a knowledge that there's not going to be corruption. And this is so important for everybody to actually be able to claim their future and understand where the government's responsibilities lie and how we can forge partnerships.
When we look at it from a political perspective, a lot has been said about this national dialogue and what it should do. In the Government of National Unity, what do you think then, should be the guiding forces for it with this national dialogue? I'm asking you this question because as the national dialogue convenes, a lot of suggestions have been that it should be the one that basically informs the government mandate, particularly if you look at it from a multi-party, dimension. And that should be the mandate that then guides the GNU, especially if you start seeing, the cracks that we've been seeing over the past few weeks.
Well, this is such an important milestone in our country's history. And if it's implemented and respected and taken in a mature way, I really believe it can provide a platform for all South Africans to come together, to collectively envision our country that we aspire to be. And with its key objective being, to look at reflecting over the past 3 decades, I think it's a chance now to co-create the future for all South Africans, especially the most vulnerable, so that they too can thrive. And we need to start addressing the inequalities, the injustices, and the ongoing widening gap between different sectors of society.
And earlier in our introduction, we of course quoted from Professor Tinyiko Maluleke, who said that at the heart of the country's failure over the past 30 years is weak leadership, failure to implement government policies. You've also just mentioned it now. And all the recommendations from the number of summits, indabas and commissions we have held. In fact, the Zondo Commission is one that we have also mentioned, where the recommendations are yet to be, implemented in their formality. When you look at this national dialogue, who then should be in that room? If we look at the number of problems that we have in this country, who are the leaders that should then be steering the ship going forward?
We need to empower grassroots organizations. And in South Africa, we have approximately 250,000 registered NGOs, and only 25% are compliant, which means that so many of them providing services that the government is not providing, and they're doing it out of their pensions, out of the church donations. These grassroots NGOs and CBOs need to be capacitated to understand that they've got to hold government accountable. The sitting back and having, policies thrust downward without consulting grassroots level community members is not working, and it hasn't worked. And, for example, I think there's 8 government departments addressing GBV. There's at least 13 policies that have addressed GBV, yet GBV continues to increase between 3 and 5% per annum. We've got to look at the causal factors, and we need the communities to be able to go to local government and say, this is enough. This is where the money needs to be invested. You have to listen to our needs. We are the ones who understand the solutions, and that's the way it's going to work.
Dr. van Selm, thank you so much for your time. Really do appreciate it. Dr. Lesley Ann van Selm from Khulisa Social Solutions.